Assalamu alaikum and very warm welcome to everyone. Thank you for joining us today. My name is Shakir Zainal and I'm the head of Mohammed bin Rashid Innovation Fund, joining you for the yet another insightful innovation journey session where we bring your conversation with the brightest minds from the entrepreneurial ecosystem, dive into their experience, which help other founders to learn how to accelerate their growth and maximize impact. As usual, this session will run for maximum of 45 minutes, of which first 30 minutes, as usual, are allocated for main discussion, followed by Q&A session. Please type your question in the comments section, and we will do our best to pose as many of them as we can in today's guest during the Q&A. So, moving quickly on our guest for this episode, Sarah is an MBRIF alumni and a founder and CEO of MDBX Health for the past 13 years. She's been on a mission to fix what missing in Abu Dhabi healthcare system, working with the big names like Cleveland Clinic, Amana Healthcare, and G42 Healthcare. These days, Sarah's pouring her energy into MDBX Health. They're, they are tackling a really important issue, helping those who need it most in the UAE during the tricky times between doctor visits when most of the care actually happens at home. So let's all welcome Sarah to this session and the episode. Welcome.
Thank you very much. Nice to be here.
Fantastic. So let's deep dive into some of the questions. And from what I understood, that on your earlier career in environmental science and law to a health tech entrepreneur, you have almost dedicated over a decade of your years and time to improve healthcare in Abu Dhabi. What initially sparked your passion for addressing such an important issue and a gap in the system?
So there's nothing like healthcare in terms of, from an industry perspective, there's nothing like healthcare, but from an ecosystem perspective, there's nowhere like Abu Dhabi and like the UAE either. So healthcare is really important to me, particularly from an entrepreneurial perspective. When you find a gap in the health system, it's not like finding any other gap to fill. So it's not like shoelaces irritate you, and so you make those little springy ones that make it much easier. In healthcare, if there's a problem, it affects people's lives, it affects their health, and the consequences are sometimes death and sickness. And this is something that's really, really affected me deeply in my life and in my career. So I very much focused on identifying issues in the health system, and I very much focused on trying to fill and resolve those issues, to find solutions that have a really significant impact on people and on their lives. The Abu Dhabi ecosystem is like an absolutely phenomenal place to do that, because when you find gaps like this in any other country of the world, sometimes the bureaucracy makes it so difficult to innovate in these gaps. Whereas here in the UAE, the innovation, the access, the fluidity of the environment allows you to both innovate, but also to implement those innovations in the ecosystem. So for me, this is like the perfect storm for aligning planets and healthcare innovation. And it's really what makes me happy. So this is why I've landed up here. Great place, great industry.
Yeah. So, so you have worked in a very well-known and eminent organization like Cleveland Clinic and G42 Healthcare. So, I mean, if you can share what was the pivotal moment that inspired you to take the entrepreneurial leap, and of course, you started or founded your MDBX Health.
Yeah, so I've worked for some amazing organizations, and part of, I guess, the joy of working for these amazing organizations is the people you work with. And I was very privileged to work for two very, very incredible entrepreneurs for an organization here. that was eventually part of Mubadala. And I learned so much from these two guys. They changed the way I looked at the world and really showed me how impactful you can be if you go out and you identify these gaps and you pour your energy in. I obviously worked for G42 for a while, for Mubadala for a while, for Minor Healthcare for a while, but after a while, like the urgency, the desire to have fast impact and to be able to control the movements and to be able to innovate into some of these gaps became overwhelming. And I think after a while, I felt a little bit like a dog in a cage, and I really wanted to get out and get my teeth into some of these problems and solve them myself. But also it's impossible to be in this environment and not like take advantage of the opportunity to innovate and the support of the innovation environment. And obviously things like Mohammed bin Rashid Innovation Fund are such incredible tools that can help us do this. So I at some point had to jump, and I jumped, and it's the most amazing thing I've ever done. I absolutely adore being an entrepreneur. And it is hard, but the rewards are profound. So
Yeah. See, I've heard you a couple of times. You're talking about unsupported healthcare void, right? And so, can you explain? I mean, I've also heard the concept like layman's terms and why it is so crucial to be addressed. So, talk to me about that a little bit more.
sure. So one of the things that I noticed while I was working in the system was this gap. And I think one of the first rules of setting up your own business is to try and keep it simple. And this gap is such a simple problem. And it was something that really upset me for quite a long time. I watched a lot of people become homebound, be vulnerable because of this problem. And this problem is the void that I talk about quite a lot. And basically, it's really obvious when you think about it, but we invest a significant, actually the world over, this is not a system issue, this is a global perspective on healthcare issue. But we typically say to someone who's not well, go to the doctor, and they'll spend 9 minutes with that doctor. And during that 9 minutes, they might learn that they have a serious illness, they might have some more information about that illness, but typically they'll spend about 9 minutes with that doctor. And during that 9 minutes, they'll have a catch up. They'll be experiencing whatever examinations go on during that session. They will be advised on what to do with themselves for the next 3 months, and then they will be sent out of that doctor's office. And this is what really, really got me, is they get 9 minutes with the physician and the next 130,000 minutes alone to execute whatever instructions they've been given. And they're so alone. Like that 9 minutes is amazing. They're in a beautiful hospital. They have a world-class doctor. They have absolutely everything they could ask for. But then for 3 whole months, they have to take care of their health without any support. And the reality is all over the world, but particularly here as well, is 70% of those patients will fail to take care of themselves in that 3-month period. And that's when they become critically ill, and that sets the trajectory for the rest of their lives. So this is the void that I'm looking to fill, is to try and make sure these people are supported when they're vulnerable, and that health system isn't lopsided to that 9 minutes, because really that 9 minutes is just a small chunk of what happens.
So, I'm thinking more what I think about what you're saying, and you're absolutely right. Of what happens after that 90-minute. Okay, so let's I know building a company. I mean, an easy to issue a trade license in UAE, and you can get the bank account now. I think that's been easy, but I don't think once you go live and then you want to build it and you want to accelerate it and you want to survive, it's not easy. Businesses are not easy. So can you share, being an entrepreneur, being, you were a startup, share some significant challenges you faced in your journey and how you have overcome it, and what lesson did you learn or do you want to share with our audience today?
To be totally honest, this has absolutely been the most difficult journey of my life, the most amazing journey. But when you ask me to isolate a single challenge, there are so many. They're equally matched by amazing, amazing things that happen there. But from a challenging perspective, and I think you'll hear this a lot from entrepreneurs, is I particularly found it difficult with the loneliness. And it's not that you are alone, because you have people around you and that's fine. But really, at the end of it, as a founder, it's very lonely, because this business becomes your baby. Once you go through that process and you set up the license, you get the bank account, you start to build up the systems, and you start to understand what potential it has. You live it, you eat it, you breathe it, you sleep it, you don't stop thinking about it. And nobody else feels about your business the way that you do. And no one can truly understand how it feels when you have a door slammed in your face. And no one can understand how elated you feel when something good happens. And so no matter kind of how you shape it, you are always kind of alone. And for me, that was the biggest struggle. It was very much something that I wasn't expecting to feel. But ultimately, you are the person that knows what the best next step is. And my solution to that, it took me a long time, and still it's something that I find really difficult. But the solution for me to that is absolute relentless networking. And it's funny, because I used to absolutely hate networking, and it was something that I very much detested, but now it's one of my favorite things. But over the last 2 years, I've met thousands of people. And all of them have been amazing. People in all different parts of the sector, patients from everywhere. This makes me feel like I'm not alone. But also throughout that period, obviously 1 or 2 particular people have become my mentors and have become the people who understand me, even when I'm incomprehensible and even when I can't even have a coherent sentence. They know. And I think that's the most important thing for a founder, is finding your people and talking. You have to weed through so many to find the people that fully understand what you're doing and can help you through it. It's really important. I think it's the only way to be able to survive.
Yeah. I've being in EDB and Mohammed Barashid Innovation Fund, I've seen so many ideas, so many hospitals, clinics coming in to invest into an R&D and technologies, and I've seen it. I mean, I started trying these, Aura rings right now, and I have these glucose monitoring. It's just a monitoring device. Yeah, the watch that you have, fantastic, and then the way they track you, they know everything about you. By the way, they and the guidance that we get regularly. There's no doubt there's a transformation. There's a lot happening around technology shaping the future of healthcare for sure. So, what really excites you the most about these, possibilities and how the sector is evolving?
Oh my gosh, it's so exciting. I absolutely love it. Like, I think this is part of the reason I'm such an excitable entrepreneur in the health sector, is that intersect between tech and healthcare is phenomenal. It is, for me, super important to say that tech is a really good addendum to healthcare, because it will never replace healthcare. And I really like that. As long as we maintain that person-to-person contact, the tech intersect just blows it out of the water. It is amazing. For me, this is something that gets me really excited. I don't know if you've heard of the Medici effect, but I'm besotted with this concept, which is where the art renaissance came about, which is the Medici family overlaid different industries, art, science, and created this whole new beast that was totally unrecognizable and had a huge impact on the earth. And in every revolution thereafter has been created at this intersect between different industries. And for me, when I look at what's going on in healthcare right now, it's a little bit of a revolution of this overlaid or this intersect of industries. Healthcare, technology, the ability to be able to use AI to do early detection, to be able to understand the trajectory of our health, how our history impacts how we're going to proceed, all of the things that we weren't able to do, monitor patients remotely. Like, we've got all of these developers, engineers, all of these people that have nothing to do with healthcare that can look at healthcare with fresh eyes and say, what would be really cool? If we could robotically operate on someone's heart, and if we could watch it from Tokyo. Like this, the actual potential behind this is endless. And every day the advances just with ChatGPT, once you start overlaying it and reflecting it on what's going on in the world, deeply, deeply exciting. So I think as long as we maintain that person-to-person contact at the baseline, the tech absolutely excites me. And I think MDBX is a crossover between tech and smart pharmacy, very much leverages what we can put on top of healthcare to make it accessible, affordable, and way more effective than it ever was before without that intersect. So long story short, very exciting.
I can see the spark, and I can see the motivation and passion to all reflects on your energy, and I can see that positively. So what I mean, I'm sure you will go through ups and downs. There are a lot of challenges. So what keeps you really, motivated and of course resilient to keep, I mean, you need to keep your passion alive, right? So what's that secret if you can share with us?
The secret. So I think what's really important is understanding that setbacks are not setbacks, or using them as learning experiences, recognize them as learning experiences. This has been a really difficult thing for me to overcome and to learn, but it's now, I think, my greatest strength, and I'm grateful for it every day, is that when doors close, when they slam, when opportunities fall at your feet and you've spent months building towards them, it used to feel to me like that was the end of the world and that I'd wasted all of this time and I would be absolutely devastated. And that's when you fall, it's really difficult to stand up again. But I think now the way that I look at it, and this is after many, many setbacks, every setback is there for a reason and it happens for a reason. And actually, it just opens up for more opportunity. This is like an incredibly important mindset, I think. And it's funny because at the beginning, when you have your first setback, it's the worst because it represents a ratio of your journey of significantly more than it does now. But after a few hundred setbacks, you realize that it's just one and there's plenty of other things that you can think about and focus on. But it is really interesting for me because I look back at all of the things that haven't worked in my journey so far. And at the time, while they were devastating, now I'm so grateful that they didn't happen because such amazing things have happened in the meantime. And where I've landed up is I'm 1,000% certain the best place I could have been. So I think ultimately that's the crux of it. The resilience comes from just accepting that it's a learning experience. It's not a setback and everything's going to be fine. And then you have the power to keep going. It's fun.
You know, I've been I always keep hearing, people compare hospitals, clinics, and different service providers, and I know they're all a lot of them are driven very commercially, so. And then the healthcare space in general, ethical element of it is very, very important, and it has to be extremely. The consideration are very paramount, very important. So I wanted to understand from you what are some key ethical principle that guides your work.
This is such an interesting question because this has changed significantly for me since the beginning of my entrepreneurial journey. But I think one of the biggest principles that I focus on is the fact that healthcare, from my view, can't operate as a business. And the world over, healthcare operates as a business. And what this means is that it's capital heavy. It needs to generate revenue. Revenue comes from demand, and demand is sick people. So really what we're operating is a facility or a hospital or a system that only succeeds if we've got a lot of sick people coming in. So there's not quite the right incentive to send people out healthy because you should be creating customers, not trying to, I guess, take them out of the system. And I think all over the world, this is how innovation in the healthcare system or healthcare sector works, is we create ways of fixing problems instead of preventing them. And so I guess long story short, my ethical position is that we should be trying to find and operate healthcare as a business that incentivizes not getting people sick in the first instance, instead of the demand of sick people. This, for me, I think is the most important ethical consideration. Obviously, there's a ton of them. It comes down to kind of access, people being able to have equitable access to healthcare. But for me, the primary thing is to try and support people who are unwell and stop them having to go into facilities and stop them having to generate revenue as opposed to the other way around. I really have a deep interest in preventative and proactive healthcare. And so in the background, I spend a lot of time working with other healthcare specialists and experts to find a way to build a profitable health system that focuses on incentivizing health as opposed to sickness, which I'm sure you've heard a lot about. It's something that no one has really nailed yet. No one really knows how to do it, but I am convinced that the UAE is the first health system that's going to find the right business model to be able to ensure people don't become the demand instead.
Yeah, very interesting.
Mm.
I think it's a journey. I think people it's a learning journey for even human being. I mean, I'm talking. I've seen a lot of people right now. They proactively go for checkup rather than waiting for them to fall sick, and they have been picking the hospitals that who were ethically, or they've been extremely direct in their approach, and the consumers, I'll not call them patients. I think they are normal human being. There's nothing wrong with them.
Mhm.
They are picking and choosing the right, health provider to prevent and do proactive, not a maintenance, but proactive, checkups. And I've seen how those businesses who were built on such a strong ethics and such a strong, principle have really paid off in the long run. That's what I've
That,
seen. It's working.
exactly. Yeah.
Yeah,
And
yeah.
that's how I'd like to see the rest of the health system. In the perfect world, everyone goes to the doctor to ensure that they stay healthy, not the other way around. But that's not the status quo anywhere in the world at the moment. So this is definitely something that I'd like to reshape.
Fantastic. So again, back to the ecosystem and the collaboration. I always believe there's a private sector somewhere, and then there are the governments, agencies, and government entities, and then there are technology providers. There's a lot of these partners are very critical in them collaborating together to build that healthcare system or healthcare ecosystem, I will say. So how have you seen that? How have you seen that changing in UAE, and how that worked for you?
This is what I love. This comes back to the Medici effect again as well, as people that are specialized in all different parts of the system coming together and seeing what comes out the other end. I love this, and this is something that, so over the last 13 years, I've seen increasingly. At the very beginning, we used to be very siloed, but now people are sort of starting to creep over into different silos, and it's really fun to watch. We've still got a long way to go, and I spend a lot of time, as I was saying before, pulling together all of the people in my network that know different things about different parts of the system that fit really nicely together. But I see it all of the time, and I love the events that are coming up. I love the way that the government facilitates the co-working. There's a lot of, even the environment I'm in now, so I'm in Hub 71, there's a big crossover of all different industries that are all working together to build amazing things. But for me personally, what I've seen as well is that there is so many points of innovation that never come to the surface because people at the front line aren't really involved in that process. But if you get someone, a surgeon or a physician at the front line, and you put them in a room with a regulator and you put them in a room with a payer, strange things happen, and it is amazing. And particularly if you put like a software developer in there as well, is they start to build the most incredible things. And this is what I try to facilitate as well in my networking groups, but also whenever the opportunity comes up in government groups, which I've had the opportunity with the Department of Economic Development and with all of the different organizations that have cross-functional disciplines, it's amazing. It's getting better and better every week, and I am convinced that this is the future. And this is what differentiates the UAE from the rest of the world as well, is breaking down those silos happens quickly, and the innovation that comes out the other end actually has a route to market. So it's very exciting.
Yeah. So what do you think is the most, I would say, underrated joy, and B, I would say, overlooked aspect of being an entrepreneur?
Oh my goodness me. For me, I think the most underrated and unexpected part of being an entrepreneur, joy of being an entrepreneur, is the fulfillment that you get from it. I had absolutely no idea that a person could be so fulfilled as it is being an entrepreneur. And it all comes into how many times you fall over and stand up and fall over and stand up, and the support that you find in the system and the people that you meet. But it is incredibly fulfilling to come up with a really good idea, be proud of it, and then have so many parts of even the government system, all of the different organizations, people in the private sector, people in the public sector support that. It honestly feels amazing, and it has totally changed my life. And I always encourage anyone who's thinking about it to go out and do it, because I don't think you realize how much of an impact every single individual can have if they just put themselves in that little bit of a risky situation. But when you do, like, the whole world opens up. It's really an amazing mindset shift. It's a strange but rewarding development in your confidence, your personality, your world altogether. Even my children are super proud of me, and I love that. So I think really the shift in the mindset is probably the most underrated thing about entrepreneurship. And then obviously the impact that you can have on the world when you kind of step off the main street and start to explore. So very underrated, very, very underrated.
Yeah, interesting. So, this has been always my last question before we go into the, questions and answers questions from the audience is, what would you, I heard you out very loudly and clearly that there's a lot of things you're happy that did not happen. And, at that time, maybe you were not very happy with it, but now when you look back, but if you go back, I'm sure there are, if you would have gone back, you would have really done it differently. I've heard different answers from a lot of entrepreneurs in these sessions, and they all had a long list of things, but they enjoyed the journey. Basically, they never regretted. But I think specifically coming back to you drill down. What do you do differently if we go back in time?
So much, almost everything, I think. But I love that I learned it all. I love that I know more now than I did then. But this is definitely one thing that I try to do, is spend as much time as I can with other healthcare founders so that I can give them all of the shortcuts, all of the lessons that I learned that I wouldn't do again. But I think personally, if I could go back 2 years ago to the beginning, I would do what I think my biggest impact has on my business. The biggest impact has been the network and the prolific networking. But if I could go back to the beginning, I would talk to more people, and I would accept and open up about the vulnerabilities that I had and the problems that I needed help with very, very early on. Because I think I came out of the gate as an entrepreneur wanting to show everybody that I was really strong and I was really confident and everything was going to be fine. But actually, if I'd said, can you help me with this regulation because I don't know how to do it? Or can you help me even open a bank account because I don't know how to do it? I just wasn't communicative or open enough at the beginning. And what I've found over this time is the more I talk, the more I tell people my ideas, the more open I am, and the more open I am to hearing what other people say, the quicker I get where I need to go. Like, and no one's judgmental at all. Everybody is really kind. This is something about the UAE. I've never had anyone be mean to me. And I think if I'd known that at the beginning, I would have been way more comfortable to say, hey, I'm just starting out. Can you give me a hand? Can you help me navigate the payer system? Can you help me navigate market access? Any of these things can be totally shortcutted from the very beginning if we just communicated better. So I think the one big thing I would change is the way that I presented and came out the gate at the beginning, and how open I was and how open to suggestion I was.
Yeah. So let's move on, because of a conscious of time. We have only 7 minutes, so maybe we'll go to the first question, and maybe we have one or two questions to answer. So, who has been your biggest mentor in your entrepreneurial journey, and how has this guidance you shaped your approach to the leadership?
Interesting question. So I was very privileged to be venture built at the very beginning of my journey. So back when I was in ideation, I had the privilege of being accepted into a venture building program with a organization called Modus Capital. And they have, throughout my journey, been phenomenally supportive, strategically, technically, operationally. They are considered, they are an operational co-founder for my entity, but they have mentored me through this process, picked me up when I've fallen, and done absolutely everything in terms of support that I could have ever asked for. And they have been the consistent mentor, I would say, throughout this process for me. So very lucky.
We will go to a question from Reem. Can you share a specific example of a time when you had a pivot or adopt your business strategy at MDBX? Yeah.
Yeah, there's been a few of those. So I started out in a B2B position. So I always wanted to go. So basically, Medbox or MDBX is a mechanism by which we can support people that have to take lots of medications, which is a big issue. I thought every single one of us have been helping someone in our family organize pills into a pill box. What we do is we simplify really complicated medication. We put it into little sachets and we link it to a digital application that reminds patients, but also keeps their family in the loop, understand what's going on. We take medication adherence to the next level, and it has a significant impact on the health of individuals over time, particularly in that void. But we went B2B at the beginning, and what we found at the beginning is that a lot of private hospitals and clinics didn't really want to get involved because it was a risk because it's a digital platform that they're not familiar with, but also it wasn't something they were understanding the impact on the revenue model. So we had to shift, and actually the better place that I ended up going was B2G, business to government, because really it's the government that cares the most about this void in the middle. So pivot from B2G.
Yeah. Sorry. So coming back to another question, maybe the last one. What is the best part about working with MBRIF group? I'm sure this is one of my MBRIF members have plugged this question.
I loved working with the MBRIF group. I was introduced to so many people throughout the program, and every single one of them was a game changer. So intelligent. Everything from financial support to the strategy support, marketing, everybody I met blew my mind. But also there were so many business connections as well. And actually all of my live contracts at the moment came through Mohammed bin Rashid through connections. Absolutely phenomenal experience. And I absolutely meant it when I put in my LinkedIn that MBRIF is one of the significant elevators in the entrepreneurship world. It is huge. It is a real game changer. And it absolutely phenomenal how they can pull together so many esteemed and smart individuals that can be so supportive in all different industries. Very cool. So that was my favorite part.
So we'll go to the last question. I think, how do you ensure that your healthcare solution engage patient effectively, and what role does feedback play in your product development?
Right. Feedback is everything, and actually it has to be valuable for the patients, and that's all that really matters to me, is making sure that they're supported. So we can see everything in the back end of our system. So it's all driven by an application. We can see about 700 to 800 data points from every patient, obviously tokenized, so there's no confidentiality issues. But we can track how difficult it is for patients to understand their medications, to take them, and we can see if they're engaging with the product as well. So we can see quite a lot of information on the back end. Data, obviously, in the tech world is one of the most important things, and we get a lot of this, which helps us to guide the patient care. So
Great. Okay. I mean, unfortunately, that seems to be all what we have today. I would like to thank you, Sarah, for your invaluable time and generous insight. Thank you to everyone who was listening to us. Sarah, thank you. And I hope definitely we will always interact. You're an alumni member, very active one, from what I know also. So thank you for all the support and guidance you have been given to the team. I'm very happy. I'm glad that you're being really happy from MBRF. So I hope the audience have enjoyed this conversation, and I request all of them to keep watching or looking out for these announcements. We keep doing this regularly. So until the next time, Sarah, and to all the audience, thank you very much and have a good day.
Thank you so much. Thank you. Bye.
Bye.